my name is Larissa, and I'm a pharmacist. I chose pharmacy, like Dave said, not necessarily right away. My mother's a pharmacist, and ever since I was a little girl, she would sort of guide me and lead me towards the pharmacy. But I felt like I had to make my own choice. And here I am as a pharmacist, just as my mother wanted me to be. But in turn, we do really work together very well. I'm hoping to bring to you two different experiences in two different pharmacies. We have a more established pharmacy, that's Pepperell Family Pharmacy. In that store, that's where I sort of became a little more comfortable, got my sea legs as a pharmacist, so to speak. It really started with our synchronization. In that pharmacy, we have a much higher volume, and we also have two pharmacists there. So some of the staffing concerns, as I know a lot of you may have with the MTM and some of the other programs, there are two different pharmacies. Like I said, one with two pharmacists, and then the new pharmacy with only one pharmacist. So that poses two different barriers in and of itself. I'm hoping to address some of those as we get going. So for learning objectives, first and foremost, I'd like everybody in this room to understand how they can optimize what's available to them. Where do they find the MTM cases? How do they utilize those opportunities? And most importantly, how do they put that into their daily workflow? Secondly, we'd like to identify some ways that you can involve some support staff. Let's get other technicians involved. Let's get pharmacy interns involved. And other support staff like clerks and other people in the pharmacy that can really help you and assist you with immunizations, MTM, other adherence concerns, and refill synchronization. The other thing I'd like to talk about too is truly the positive impact of MTM. I really enjoy doing it, if you can't tell, but I know that there are some significant barriers with implementation. So I'm hoping to outline the benefits to your business and ultimately providing that customer that walks through your door the best environment. Okay, so where do you find these opportunities? If you don't mind, with a show of hands, how many people are involved with Marixa? Good. How about outcomes? Okay. How about both? Okay, good. If you don't have a register, or you don't know how to register, the websites I put on the slides as well. But it's very easy to get yourself registered as a pharmacist and your pharmacy registered as well. So to kind of look at MTM as a whole, if you're not using the platforms, you are providing MTM services every single day. They vary between immunizations, between counseling, disease management, health and wellness, different programs that you already do, brown bags, any services that you're already doing, it's part of MTM. So I'm trying to get you guys to see it as a whole, utilize the platforms that are available to seek the reimbursement that we all properly deserve. So I'm not really biased necessarily. I'm more experienced with Marixa, so a lot of my slides are going to focus on Marixa. I'm a very new user to Outcome, so if somebody in the audience is very comfortable with Outcomes, I'd love to talk to you at the end of the show. But I'd like to just talk about it as an overview. So basically, the companies are finding these patients for you, and they're presenting them to you as a pharmacist, saying this particular patient has a comprehensive medication review, and there's an opportunity for you to talk to that patient about differences between safety alerts, cost-saving alerts, and any care gap. It also gives you an opportunity to engage directly with the patient and with their prescribers. In our pharmacy, we really pride ourselves on opening the lines of communication between the pharmacist, the patient, and the prescriber. We'd like to make sure that we're known as an advocate for the patient, but a resource to all the prescribers as well. Once you open those lines of communication, it makes those phone calls much, much easier. It makes that phone call to reduce the dose for your high-risk medications that much easier. So there are two types of medication therapy management cases that you really see. You've got a Retail Star Adherence Intervention Program and your Medicare Part D MTM. So I'd like to talk a little bit about both of those and how they differ. So for the Retail Stars Adherence Intervention Program, essentially the insurance company has retrieved these patients that you fill at your pharmacy and identify them as having either potential non-adherence or evidence of non-adherence. These particular patients would definitely benefit from a meeting with the pharmacist. By engaging with them, you might decide that there's a simple answer for why they're not taking their lisinopril. Well, that's because the doctor took them off of it. Or, there might be more of a complicated root cause, but it gives you an opportunity to really touch base with that patient so that you can identify what's going on and potentially mitigate that problem. These particular cases, I put down $12 per case, but I believe it's $12 per alert. So I'm not 100% sure on that. But it's not as much as the other cases. So the types of medications that these insurance companies are looking at are very similar to the particular medication classes that Scott just talked about. They're your cholesterol medications, your statins, you've got your hypertensive agents, your diabetes medications, and there's also an opportunity for an omission in care. So if your diabetic patient is missing something in their medication regimen, it gives you an opportunity to make that recommendation. These are also patients that are flagged that are ideal to add to a synchronization program if they're not already on them. So for the Medicare Part D MTM plans, these are your all-inclusive 60-minute cases. They pay $60 a case, and they're very clinically complicated, at least I find personally. And they take a lot of time. So what I'd like to try to do is give you guys some pointers about how you can incorporate that into your day-to-day. I suppose I should probably explain some of the safety alerts would be like a drug-drug interaction, a duplication in therapy. Cost-saving alerts would be, I haven't seen one yet, but I'm presuming it would be a Crestor versus an atorvastatin, an Agrinox versus a clopidogrel, and then care gap alerts, which we talked a little bit about, people who might be missing agents in their regimen. So eligible patients that they're finding for you are patients that have 3 of the following chronic conditions. They'll either have asthma, chronic heart failure, chronic obstructive pulmonary disease, depression, diabetes, or osteoporosis. They're also using 8 or more of what Medicare decides as being chronic maintenance medications. And they also have an anticipated drug expenditure of about $3,138. So these are already your complicated but high-valued customers. During your meeting, there are a lot of required elements. You're going to do a face-to-face. If you're in outcomes, it has to be face-to-face. Marixa permits a phone meeting. In your patient assessment, you're going to be talking about allergies, clinical conditions, lab data, and your overall assessment of the patient's medications. You're going to do a medication review. You're going to do an alert resolution. So anything that's been flagged in that patient, if they have a drug-drug interaction, if they have a high dose, if they're having a duplication in therapy, if they're missing particular agents, it could be that they're just paying out of pocket for their aspirin, but there is an antiplatelet on the board with that patient. And then you're going to come up with your medication action plan. And that's essentially speaking, what did you and your patient talk about today? And then ultimately, what is that patient going to do based on what you guys talked about? And then lastly, you're going to do your authorization. This is, once you submit everything, this is the form that Scott was saying about how you have to give it to the patient. Either give it to the patient when you're done, or you have 14 days to either hand it to them or send it in the mail. So there are quite a few different barriers that I've thought of when providing the MTM services and things that we've experienced when trying to incorporate them into our workflow. The first that I came up with was time. They take a lot of time. Staffing can be an issue. If I'm in Tyngsboro, I'm the only pharmacist. Potentially I have a clerk with me, maybe a certified technician. But if you get interrupted, you've got a doctor that calls, it's very difficult to kind of make an appointment with that patient and then get pulled away. Computer skills could potentially be a limiting factor. I know, Mom, sorry to call you out, but she couldn't find www.marixa.com if she had to right now. Right, Mom? She's shy. So computer skills are definitely an issue. Obviously, we're in a world where our workflow is so high. You're constantly interrupted. You have a lot of different things going on. You have a very multifaceted level of business. I'm sure most of you do assisted livings and deliveries, and you have a million things going on at the same time. So increased workload. Scheduling the appointment is actually my favorite thing to do because I like to make that first phone call. But that can pose a problem. Patients are not used to making an appointment to see the pharmacist. They just simply forget. So scheduling, patients may not be interested. which is okay. Patients who you successfully schedule the appointment and then all of a sudden they forget is a barrier. And then potentially anger towards the insurance company. I know a lot of you may feel that this is just one more thing that the insurance companies have added to your plate, and you don't know how on earth you're going to possibly do them. And yet you're going to start to be graded on them. Yes?
Two other ones, language barrier
Okay.
and view-assisted living, patients with dementia.
Yes.
So how do you handle those?
We do service a memory care unit, and some of our patients have been pulled from Marixa. We have attempted to call a family member if possible. At least we try to make that initial phone call. Oftentimes they're not familiar enough with the particular family member's regimen, so ultimately we do end up declining those cases. Language barrier, I haven't had an issue with that. What was the other part? You said memory care and...
Yeah, language barrier. When we first tried outcomes, 4 out of 5, we couldn't pronounce their names, and they couldn't say all the time.
Are they customers at the pharmacy? Oh, interesting.
No, we didn't have any, so then they did a zip code search.
Oh, okay.
Last,
Okay. So I think at that point you'd have to decline because you wouldn't be able to service the patient. I think Marixa you can print out the medication action plan in Spanish. I'm not sure about outcomes though. Yes.
So 2 comments on the group home thing. There are options in Marixa to do a care provider. So if they have maybe a visiting nurse, you could use that person, and there's actually a checkbox for that. And then for everybody in the room, when it comes to your pharmacy barriers, it'd be a lot better served if you load their medication list first, because the meds are going to trigger other things that you need to address. So just from personal experience, I did a couple of these Tuesday, and if you load the meds in first, they're going to be going backwards, calling the patient again, asking more questions. So I would load your med list in first before you do anything else.
Anybody else? The other thing that I found to be a barrier was the time frame for the cases. I find that in Marixa, if you don't open the case or start something in the case, you only have 10 days to do that. They'll sort of go away. If you open the case and even don't do anything, it gives you the full 21 days, which I find to be really important. So let's talk about some benefits of providing these services. First and foremost, you're furthering the connection that you already have with your patients. You're creating collaboration between yourself and the providers, or the caregivers, or the family. You're obtaining a greater level of respect from your own patients. You're increasing the patient-provider-pharmacist connection and interaction. Like I said in the beginning, you're really opening those lines of communication and throwing yourself out there as being a provider. You're establishing trust with your patients, achieving a more personal interaction, feeling more part of that healthcare team, increasing patient loyalty, and most importantly, you're increasing your own patient satisfaction and ultimately providing the best possible care that you can as their pharmacist. So when we first started doing MTM, I tried to do all of them by myself. I found very quickly that it was not the best way to do it. I really like doing it, which is why I was motivated to do it, but I found that by incorporating as many people as you possibly can is the best way that you can get that service to the patient and you can increase your completion rates for your cases. What I tend to do is I'll get every pharmacist that we have on staff registered and enrolled with Marixa. Some pharmacists are a little bit more excited to do the cases than other ones, so we've had a bit of a pushback between some of them. Pharmacy technicians can be very valuable too. They can make phone calls for you. They could schedule that first that first appointment. And what I like to do is also partner with your local school of pharmacy. So I have interns with me almost all the time. We get placed with our local school of pharmacy, which we use Mass College of Pharmacy, and they'll come and help us. And they're excited. They're eager. They can't wait. They are all MTM certified, at least through the Mass College of Pharmacy program, which means they've done the completion. They've done the whole day program, and they're eager and excited to actually do a real live case. I also find that our customers love having students, and I always ask when I make the appointment, is it okay if I have a pharmacy student here with me? Like, it's a great learning opportunity for them, and it's something that they can really work on and help you do and complete those cases. Marixa is really good about sending you email notifications. So in the morning when I wake up and I check my email, they'll tell me if I have new cases. They'll tell me if I have cases that are coming due. They'll tell me if I have, a certain amount of time to complete those cases. And I'll print the list of patients. And we'll put them all over the pharmacy. And that way, if your clerk finds Mrs. Smith coming in and they see that she's on the list, they know to go flag a pharmacist to either make that appointment and scheduling a time for the MTM. This is also just really helpful for anybody who wants to provide the services or be a part of this but may not necessarily be the pharmacist. I know for my mom, I'll actually print the cases for her, so she doesn't even have to go near the computer, she doesn't have to go online, and she'll just write all the answers and meet with the patient if she has an opportunity to do that. So some other tasks to delegate with your staff. Scheduling and appointment reminders, that tends to be really helpful as patients have forgotten about appointments. I've called them 30 minutes beforehand to remind them that they have an appointment and they're in the middle of laying a new floor in their house. So he was not coming that day. But if I had a technician, maybe call him the day before, that probably would have been a good idea. It also focuses a lot on the medications that we are being rated on with our star ratings. So it's a great opportunity to complete those cases and keep all of your numbers looking really, really good. It's a great opportunity to flag more patients to synchronize and kind of start that program if you guys aren't already doing it. Paperwork, our technicians, we have them help us with almost everything. They can submit claims for immunizations. They can have them all signed up and ready to go with all their questionnaires too. And again, as I said, pharmacy interns are very eager. I essentially have them do all of the data prep. They input a lot of the data, and they're with me side by side when we do the actual case. So that's really pivotal for them to help me with that. So making the first phone call, as I said, that's pretty much my favorite thing to do because it gives you a great opportunity to connect with that patient. I'm doing both cases for both pharmacies. Tyngsboro is a very new store, so I've only had 4 cases in the first year that we've been open. So I do a lot of the cases from our Tyngsboro patients too, and it gives, our Pepperell patients. But it gives me a great opportunity to connect with them again and say, hi, Mrs. Smith, I haven't seen you in a while. How are you feeling? How is everything going? You can really connect with that patient too. So of course, the first thing you want to do is introduce yourself if they can't recognize your voice already. And you ask them if it's an okay time to talk. I really try to respect their time because I feel like in turn they're going to more respect my time. So I point blank ask them, is this an okay time to talk or would you like me to call you back? And most of the time they say, no, that's fine. And I like to explain to them the service of MTM. What is its value? Why do you do it? In making them feel like it's a service that your pharmacy provides to them because you want to be there, you want to be there for them, and you want to be the best pharmacist for them. It kind of sounds a little bit cheesy, but they all get really excited about it. And obviously, the more excited you are and how you act, they're going to be excited as well. So again, I kind of, once you call, in my mindset, I have a few ideas of when I would like to meet with them. In our store, we have quite a bit of volume. But we have 2 pharmacists, and we know that every Wednesday in the afternoon it kind of dies, and we have 2 pharmacists together, so that's a great opportunity for an appointment. Or we know on Friday afternoons it gets a little bit slower, especially in the summertime because people go away. So we have an idea of when we'd like to schedule them, so I'll throw out a couple ideas and say, how about Wednesday, how about Friday? I can do this time, I could do that time, and then we can book the appointment right from there. Once we get them committed and excited and okay to do the service, I tend to guide them a little bit and say, this is going to take me about a half an hour. In that time frame, I'm going to have some specific questions that I'm going to ask you. I'm hoping that you'll come with a couple questions that you can ask me as well. That way we make sure that we hit that program, that we hit those topics, and bring everything together. I'll ask them point blank and say, do I know about all of your prescriptions? Or would it be beneficial if you could bring some bottles in for me? Or if you could bring your over-the-counter items in, and that way we can go over the supplements as well. I have convinced a few patients to come in just because I get really excited, and especially when you're talking about asking them if you can have a student. They like to participate. They like to think that they're helping the pharmacy, and of course it's for them. Some people have said, no, I feel really comfortable with my medications. I don't think that I don't think I need this service. And I might say something like, well, by talking with us, we might come up with a few things that we may not have thought about before. And it's a great learning opportunity for our students. Why don't we just schedule a time? Well, we'll come up with a few things to talk about, and we'll go from there. So they end up being very excited when they leave. So medication therapy management is truly all-inclusive. You're not only reviewing their medications, but you're doing a lot of adherence coaching. You're reducing high-risk medications. They're flagging them for you, so that helps as well. You can also do medication synchronization. So in those patients that have been flagged for potential non-adherence, you can sign them up with your program. You are promoting the services that you're providing already. You're going to tell Mr. Smith that you have a synchronization program and ask if that's something that they might want to participate in. In that way, you're not only going to be completing the case for Marixa, you're going to be improving a lot of your equipped numbers, but you're also going to be increasing your average fill per prescription. So it's really beneficial for you, the patient, and ultimately the pharmacy. I also tell the patients if they have trouble remembering their medications that we offer medication packaging, and that really helps as well. So by opening the lines of communication with your pharmacy and the physician, you're really bragging about your pharmacy. You're going to tell your physician that your pharmacy is providing immunizations. You're doing medication synchronization. You're doing home delivery. You are doing all of these wonderful clinical activities. You're doing blood pressure monitoring, and you're sort of wrapping it up into all your MTM cases. Because at the end of the case, I always, you have to ask them, did you have your flu shot? Are you due for any immunizations? And it gives you an opportunity to really promote your services with the physician. You're able to print out the medication action plan for your patient, but you also can print out a physician letter. And this is something that you can send to them that not only links your pharmacy, the patient, and the prescriber, but it lets that person know that you are doing this. And they might have other customers that they think might benefit from this as well, and then all of a sudden you're getting some referrals from them for more customers. So essentially speaking, I have found that I've increased my professional satisfaction. I hope that I've increased my patient satisfaction, and I'm hoping to continue to improve my quality of care. And ultimately, you're going to get an increased amount of revenue for the services that you are already doing. You're just using their platform in order to submit and document what you're doing. So it's really a wonderful service.